Welcome back. We have been discussing lymphomas and leukemias and everything about them. Lymphocytic leukemias versus lymphomas, lymphoid neoplasms, acute myeloid leukemia without maturation subtype. We've been looking at acute lymphoblastic leukemia. Before that, we looked at the anemias, leukopenia, neutropenia, agranulocytosis, megaloblastic anemia. And moving on, we're going to start with a discussion of Burkitt's lymphoma, just a very basic one, a review of what we've been reading. We should know the details from reading. What would you see if you were looking at a slide of Burkitt's lymphoma? How would you be able to recognize it? Well, first you might say the starry sky, but in more detail, you should be able to see pale body macrophages. And this is what is making the starry sky appearance. That's at low power, but at high power, the tumor cells have multiple small nuclei with high mitotic index. And then of course you would see a lack of significant variation in the nucleus shape and size, giving it this monotonous appearance. So that makes it sort of starry sky. So that's the basics of when you were looking at Burkitt's lymphoma, but we need more detail. So there are five, I'm getting ahead of myself anyway. Let's just give a quick summary of Burkitt's lymphoma, what we know about it just generally. We know that it's a cancer of the lymphatic system, particularly B lymphocytes found in the germinal center. So remember that. And it can be divided into three main clinical variants: the endemic, sporadic, and the immunodeficiency associated variants. And do you remember which virus it is associated with? That's the Epstein-Barr virus. And what is it that reduces resistance to the Epstein-Barr virus? Malaria. Chronic malaria. Chronic malaria reduces resistance to the Epstein-Barr virus, allowing it to take hold. And what is it that is said to that it characteristically involves? You've probably seen the picture of the young child with the jaw, looks like a tumor coming out of his jaw, and other facial bones. The distal ileum, cecum, ovaries, kidney, and the breast are involved. So in case you didn't know, non-Hodgkin's lymphoma includes Burkitt's. So Burkitt's lymphoma, which which accounts for 30 to 50% of childhood lymphoma. And I'm just reading Wikipedia here. It says that the jaw is less commonly involved compared to the endemic variant, and it is the ileocecal region that is the most common site of involvement. So that brings us into discussions of the Hodgkin's and non-Hodgkin's lymphomas. Let's start with Hodgkin's lymphoma, and we should know that there are 5 types of Hodgkin's lymphomas. There are 5 types: are the nodular sclerosis, mixed cellularity, lymphocyte-rich, lymphocyte depletion, and lymphocyte predominance. And what are the type of cells that are needed for a correct diagnosis? These, of course, are the Reed-Sternberg cells, and they look like owls. But these owl look are actually a cell with 2 nuclear lobes, a large inclusion-like nuclei with abundant cytoplasm surrounded by lymphocytes, macrophages, and eosinophils. So there we have it. That was a very basic overview, just to jog our memory regarding the details. The details, of course, found in the book and the lectures. These are just some things about leukemia, lymphoma, anemia, and we just talked about Hodgkin's and non-Hodgkin's type lymphoma very briefly, just in detail. So I'll see you in the next videos.